Welcome to MediTech. Today, we're diving into polio, a disease that, not too long ago, was a source of absolute terror for families everywhere. But it's also the story of one of the greatest triumphs in medical history.
So how did we do it? What turned this horrifying disease into such a massive public health success story? Well, that's what we're here to break down. Let's get into it.
First things first. To really appreciate the victory, you have to understand the opponent. So let's start with the basics. What exactly is polio?
Okay, so polio is caused by something called the poliovirus. It's a type of enterovirus, and that word entero is a clue. It refers to the intestine. That's where this virus starts its work. But here's the really scary part. It doesn't always stay there. It has the potential to break out and attack our nerves, which can lead to permanent muscle weakness, paralysis, and in the worst cases, even death.
So how does that happen? How does it get from, say, contaminated water to the nervous system? Well, the path is actually pretty simple. It all starts when the virus gets in through the mouth. From there, it travels to the intestine where it basically sets up shop and starts to multiply. Now, for a lot of people, the story kind of ends right there. But sometimes the virus escapes the gut and makes its way to the brain and spinal cord, which, as you know, is the command center for all of our muscles.
And that leads to a really crucial point. A polio infection isn't a one-size-fits-all kind of thing. The experience can be wildly different from person to person. So let's talk about the symptoms and just how severe it can get.
You know, this right here probably shatters the biggest myth about polio. We hear the word and we immediately think of paralysis, right? But look at these numbers. That's pretty wild. For a huge majority, we're talking 70 to 75% of people who get infected, there are zero symptoms, none at all. And that's key because it means the virus can spread silently. Then you've got another 25 to 30% who just get mild flu-like symptoms. It's only in that tiny slice, less than 1%, that the disease takes that terrifying paralytic form.
But for that small fraction of people, the results are just devastating. Paralytic polio can cause what's known as flaccid paralysis, where the muscles just become completely limp and useless. It can make it hard to swallow, and most critically, it can paralyze the very muscles in your chest that you need to breathe. That's what often made the disease so deadly.
So if the worst happens and a doctor suspects paralytic polio, how do they confirm it? And more importantly, is there anything that can be done?
Well, confirming a diagnosis is pretty clear-cut. Doctors can look for the actual virus in a stool sample or a swab from the throat. Or they can look for the evidence of the fight, the body's response, by finding high levels of antibodies in the blood. In some cases, they might even test the spinal fluid.
And this is maybe the most sobering fact of all. Even today, there is no cure for polio. Once that paralysis happens, there's no magic pill to reverse it. All medical care can do is be supportive, help manage the pain and fever, and if needed, use machines like ventilators to help the person breathe. This just drives home why prevention is absolutely everything. Which perfectly brings us to the most inspiring part of this story, the incredible fight against polio.
I mean, just take a second to look at this timeline. It shows just how far we've come. In the early 1900s, polio was a global nightmare. But then the tide started to turn. By 1979, the U.S. saw its last case of wild polio. By 1994, the entire Western Hemisphere was declared polio-free. And today, wild polio has been backed into a corner, found only in parts of Afghanistan and Pakistan. That is an absolutely astonishing public health achievement.
But the fight isn't quite over. There's a new, pretty complex challenge. We're now seeing very rare cases of what's called vaccine-derived polio. This can happen, but only in communities where vaccination rates are really low. It's a serious reminder that the job isn't finished until literally everyone is protected.
And that brings us to our final and, without a doubt, most important section, prevention. This is our ultimate weapon in this fight.
So what's the secret sauce? What's the reason for all this success? It's this number right here, greater than 95%. That is how effective the polio vaccine is. When kids get the full series of shots, more than 95% of them are protected for life. It's one of the most powerful tools we have in all of medicine.
Now, there are two main types of vaccines that got us here. First, there's the Salk vaccine, or IPV. This one uses a killed or inactivated virus, and it's given as a shot. This is the one used in the US, and it's impossible for it to cause polio. Then there's the Sabin vaccine, or OPV. This one uses a live but weakened virus, and you take it by mouth as drops.
It's fantastic for large-scale vaccination campaigns, but it's this one that carries that super, super rare risk of mutating that we talked about.
So if you remember just one thing from our entire explainer today, please let it be this. Routine vaccination is the only way to prevent polio. It's not just about keeping yourself or your own kids safe. It's about protecting our entire global community and hopefully wiping this disease off the face of the earth for good.
The story of polio is just such a powerful lesson in what humanity can achieve when we put science and global cooperation first. If you found this useful, we'd love it if you'd hit that like button, share this with someone who might be interested, and subscribe to MediByte for more clear, trusted health explainers. Thanks for watching.